We all know Ragi is very good for health, right? But what about the diabetic patients? Whether diabetic patients can have regularly Ragi in their daily basis, whether it will give a good result in their diabetic rising level, or we should avoid Ragi in diabetic patient, because some people will say that Ragi is very good for diabetic patients, but whereas some doctors will advise Ragi will increase your sugar level, so you should avoid it. So which one to believe? Because some, even in survey, when some people had Ragi in regular basis, their diabetic level was maintained. Whereas other set of people, when they had Ragi, then their sugar level was increased. So what is the solution for this? Whether it is good or bad in diabetic patients. So today I'll discuss about this in my session. Today's session. Welcome back to Dr. Meenakshi's Medica. This is Dr. Meenakshi. MBM is MDIU, Ayurvedic pediatrician. So, some say Ragi is good for diabetic patient and some say Ragi will increase your sugar level, you should avoid. Ragi is one of the millet, we know it, right? And the best thing is Ragi is suitable for all seasons. Whether if we take other millets, some will be contraindicated in winter or some will create heat in summer. Other reasons are there. But whereas Ragi we can use in all seasons. It is best to use in all seasons, right? And coming for the content of a Ragi, the content of a Ragi is fiber, micronutrients, nutrients that is B complex, maybe any others, and proteins. These all three new contents are very essential for diabetic patients. But the thing is, Ragi has high glycemic index. So, by its high fiber content, it's very good in diabetic because due to its high fiber content, takes lot of time to get digested. So by this, there will be low or delay in releasing the glucose or sugar level in the blood. So it will be slow and steady in releasing the glucose or sugar level. So it will not spike the sugar level in a body. So by this, if the patient have 10 to 20 grams per day or 1/3 of the rice portion in a week, like 2 to 3 times of Ragi content in a week instead of rice, it will not spike their sugar level. It will maintain and it will provide or it will stimulate the weight loss also in a patient or a person. Then what about its glycemic level? It have high glycemic level, right? Due to its high fiber content, the glycemic level will be balanced. So it won't matter that if it have high glycemic level also, it will not increase the glucose level due to its fiber content. But some will say they saw a result like they increased the sugar level when they had Ragi regularly. What about this? Because they had a increased in sugar level because of their form. Because whatever we are taking a Ragi in which form and how much portion and in by combination of which diet we are taking depends on that the result will be outcome. If we have Ragi has a raw millet, then the result will be very good. We will get 100% the result. But if we had a fermented one, like a processed one, then obviously it will not give a result. Processed one means how? If we take a raw grains, usually raw grains means we can't have raw Ragi, right? It's in a portion of raw form, raw grains form. If we have, it will give a good result, 100% result. And if we are using flour, then we should not use fully processed, fully fine powdered flour will not give a result. It will give a reverse result. It will increase the sugar level in a body. So if we are having in a flour form, then it should be roughly flour form, raw coarse for flour form, and with flour, if we are having flour form, the leafy vegetables we should have. Like if we are having a dosa, then we should not have the heavy curry with that. We should have a leafy vegetables curry we can have with that, so that it will be balanced, content will be balanced. And if we are having in a idli or dosa form, then with ragi flour, you can add black gram or urad dal by mixing with the ragi flour, so that it will again the content will be balanced, so it will not increase the sugar level. And another one tip is you should not have in a sprout form. If you are having in a sprout form, it will not give any result. So these tips, if you follow, if you are having ragi in a diabetic patient, and if you follow all these tips, that which in which form you should have, how much portion you should have, and if you are having in a processed form also, with that which content you should add, so that the content will be balanced and it will not spike the sugar level. If you follow in a diabetic patient, then it will give a good result. These all tips you should follow in diabetic patients and pre-diabetic patients. Then what about the non-diabetic persons? The ragi is very good diet to maintain in a non-diabetic patients or the persons who are non-diabetic. It is a very healthy diet. It will give a nutritious diet, one thing to our body, then it will prevent the skin in aging. It will helps in weight loss, and it have lot of content to cover up or supplement has a calcium. It increases the breast milk in a breastfeeding mothers, and it prevents the diabetes for further condition, and it is very good for digestion. And another thing to add is in non-diabetic persons, you can have in any form. There is no any restrictions to have. You can have ragi in any form to get all these health benefits of ragi. So for non-diabetic, you can have in any form, and for diabetic persons or pre-diabetic persons, you should follow the tips what I said, so that the ragi will be very beneficial for your health. So now I think now you all came to know ragi is whether beneficial in diabetic or not, and if you're having ragi also, in which form, how, in which portions you can have to have a good results. So if you were knowing these tips already, kindly comment in a comment section box. And if you are not knowing also, let me know that which tips you were knowing and which forms if you have, it will reduce blood sugar level. Kindly comment in a comment section box. So thank you.